Hi, my name is Jenny. My son Chris was diagnosed with PDD back, I'd say, probably about 2.5 years ago. He is a totally different person today than he was back when he was 3. He's 6 now. For example, he would totally stim on trains. He would have a lot of trouble transitioning to just about anything. No friends, very little language. Chris is also a twin. His brother is a typical child. I work full time, and when I would pick him up in daycare, I would ask Danny, his brother, what kind of day he had, and Danny would say, "Oh, I played with Rachel, I went to the park." Chris would just look out the window and say stuff like bus, car, very little language. We were able to get him into the early intervention program for a few months, where we had some success with some language, better language. Then we moved them to a school that was better suited to kids with autism. There were some typical kids in the class, small class ratio. They did well, but still had issues with playing with children. They wouldn't play with him. He would be very content to stay by himself and play. Aggressive, and the transition issues were very, very significant, as well as the noise issues. He would look at a vacuum cleaner, he would scream. Hair dryers, lawnmowers would really set him off. And you couldn't bring him to places that were noisy. One of the speech therapists that he had said, why don't you look at the DAN protocol? And I did, and we found Dr. Neubrander and made an appointment. And Dr. Neubrander talked very, very excitedly about methyl B12, which we tried as a leap of faith, because these protocols, you're new to them, you don't know what they do, you know that they're not harmful, but we tried. And we did not tell his daycare provider that we had started the shots. Within 3 or 4 days, we would get, "Oh, Chris had such a great day. He was playing with kids. He was talking. The attention, the focus were there." And over time, this has really blossomed. Chris is now talking, and it's funny, as a parent, you said sometimes you hold back. You try, you're thinking, well, what do I say to him? And now he's like a regular kid now. He's like you can take him to Chuck E. Cheese. You can take him to loud places. He does not have a whole lot of problem transitioning. He is not on a behavior model program as he was last year. No stimming. And what we find now really is the empathy. He has friends. He's invited to birthday parties. He has friends in the neighborhood. Example, he went trick-or-treating with a bunch of kids in the block on Halloween last year. And one of our neighbor's kids fell on the grass when they were running to get some candy. All of the other kids stepped over this kid, and Chris was the only one that stopped and said, "Hey, Josh, are you okay?" And picked up the candy that had fallen and gave him his candy. We see this quite often. He's not the Chris that I knew 2 years ago. And is it all the methyl B? I don't know. Would I stop the methyl B? Definitely not. Are there issues with giving the methyl B? We typically give it to Chris at night when he's sleeping. Sometimes that's difficult because he is a good sleeper, but sometimes he doesn't sleep. So what he'll do is, we give it to him in the buttocks, and we'll pull the pants down, and in sleep he'll pull him up. I'll pull him down, he'll pull him up. I'll pull him down and pull him up. So then I have to wait and come back, and maybe 15 minutes later we'll try it again. Then sometimes he gets them every other day. Sometimes I get the days mixed up. So what I try to do is, this month is the even day, so I give it to him on even days, and I just have to make sure on my refrigerator that I have even or odd, so I'll know not to miss a shot. Have I missed shots? Yes, but I stress that when I miss a day, because I really do believe these shots are what really has brought Chris around to where he is today. And I don't know, I just, you have to take that leap of faith. You have to try it, because we've tried the diets, we've tried some chelation. He's never had ADA, but these shots, I believe strongly that these are what really have brought him around to where he is today.